It is Friday, October 1st already, 2021. We want to welcome you into Coronavirus Inside the Numbers, where we take a closer look at the numbers here in Arizona to help you make the best decisions for your family and your life. And Garrett, I guess we need to start with a pretty shocking number today. To be quite honest, I never thought we'd get to this number. It's disappointing, quite frankly, but we've had 20,000 deaths here in the state of Arizona to coronavirus since the start of this pandemic. I mean, I remember you and I looking at the numbers thinking, oh my gosh, we'd see 7,000 projected deaths and how that seems so far off.
Yeah.
But to be at 20,000 is just, it's heartbreaking. So we think of each of the families who are experiencing this disproportionate loss as we start here and we take a look at these numbers. But it's just one of the numbers you're tracking here today.
Yes. So let's go to the AZDHS website. We'll just go right into it. So as you said, 20,039. That's the big milestone for today. That we have reported over 20,000 deaths today. As far as cases, just to go over it, we have 3,600 cases that were added today too. What this means for us is that we are still in a plateau for cases. Our cases are slightly higher than they were last week, about 6% higher than last week is where the trend line is, about 4% lower than 2 weeks ago. So you can see a little bit of fluctuation here, which again indicates that we are in a plateau. But again, let's focus on the 20,000 here. So I'm gonna take off the AZDHS here. This is again, anyone can go to this site, azdhs.gov. This is where you find all of the numbers. I'm gonna pull this off really quick just to show you a timeline of the deaths that we put up. We're gonna put this up on this evening as soon as I can find it here.
Because as you pull it up, they actually plug those dates in to the date it
Yes.
was recorded, not just the date that it was reported here to us. So
Correct.
some deaths over the course of this pandemic needed further investigation to see if COVID truly was the cause there,
Yes.
because there were other complications.
Yes.
That would take time, and then it'd be
It
plotted
does.
back on
It does
this
take
map.
time. Now, what I did here is this is the reported number. This is not the epi number. So this is like when, every day when they report X number of deaths and what this looks like over the time period since the beginning. As you can see, we started reporting for COVID-19 on March 4th was the first day that the AZDHS had numbers. And then it took us about 2 months to get to 1,000. And you can see when we got to that first surge, it went to about 30 days. And then it quickened even further than that. Now, our longest period is between 17,000 and 18,000, which took about 3 months to get to 1,000 there. You see this last one took about 26 days. Now, obviously here, this is the winter surge. This was when COVID-19 was at its absolute worst. And you can see we added about 4,000 to 5,000 deaths in the same time that we just added only 1,000. So it really puts into perspective what these surges look like and really what that winter surge was comparable to what we're even experiencing now. This one, of course, a lot of the reasons why this one is nowhere near as bad as the winter surge is because of the vaccination rates, as well as the number, the people who have natural immunity. And when you add those sort of numbers together, it means that the infection rates are not as high, especially among the 65-year-olds and people who have are in much more danger to COVID-19. And so we do have lower numbers right now because of that. Although we are expected to see them stay about where they are right now.
So when you talk about natural immunity, Gary, you're talking about people who've already been infected. So we're taking 7 million approximately Arizonans in total.
Yes.
Taking 1 million of them and saying at some point in time you have had or currently have natural immunity because you've already been infected with COVID.
Yes.
We don't know the numbers that overlap.
We don't
the
know
people
the
who have been vaccinated who also were sick either before or after in a breakthrough case.
Correct. We do not know the overlap there. I do know that when you talk to immunologists and other people that are studying these numbers, they expect that what's interesting is, I think we've gone over this once before, is sort of they think natural immunity and vaccination immunity are roughly equivalent to the amount of protection you have from COVID-19. But if you have a vaccination and natural immunity, it really juices up your protection to like something to 6-fold or something. So, and again, we don't know the Venn diagram here. All we get from the AZDHS on reinfection rates and breakthroughs are sort of these disparate numbers every once in a while, where they come out and they'll say, here's what the number of people that are in the hospital that are vaccinated or unvaccinated, but they are disconnected from the COVID-19 case numbers that we're looking at right here. And so we just don't have it, like you said, Katie.
Yeah. I would just want to mention in the comments too, if you have a question or a number you'd like us to look into or show you where to find it, just post your question in the comments and we can help you find that answer. If you actually don't believe in COVID, this is probably not the chat here for you. I'm seeing a lot of comments on there and I'm thinking, well, if you're safe from COVID and you don't want to hear about it, then why waste your time on the chat here? You can make room for those who want to get their questions answered. So like Jamie's asking about the flu numbers, go for it. You can look those up too from the health department. They do a deep dive on those. And if we see our flu numbers take off in a way that we need to dedicate an hour to talk about it on Fridays, we're happy to do that as well. But right here today, it's a COVID chat.
And people, I don't want to go into the debunking too much, but people who make they believe that the flu numbers are being mixed in with the COVID numbers is just, it's not. That's not the case. They have a very dedicated
test
way to determine what is a flu-like symptom that they have been using for a long time. And so they're very good about making sure they can separate that out, those who are in the hospital from the flu and those who are in the hospital from COVID-19. There's no real interaction with those two numbers right now.
Yep. And this is a conversation about numbers, so we'll keep it right at that. If you need to ask your doctor what's in the shot, that's a conversation between you and your doctor, not something that we're going over here. So we'll move on unless there's questions in the chats as well. In fact, producer Carrie's putting the flu info up for you. If you want to, if you're so curious about those numbers, you can find all of that on azdhs.gov/flu. It breaks out all the numbers. And I think people will be quite surprised if they go look in those because a couple of years ago, we had an awful flu season. We lost an awful lot of Arizonans. It in nowhere compares to the 20,000 that we've lost here that we're talking about today. On this AZDHS site, Garrett, you're pulling up some more numbers that help us see some of those curves and where they plotted in the numbers throughout the life of the pandemic.
I wanted to give it this. I wanted to give the death numbers on the epi curve by week. And we're really going to focus on deaths today. I'm sorry, it's obviously not a pleasant subject, but because of the milestone, we're going to do this.
Yeah.
I wanted to show this by week because this really gives us an idea of what the surge looks like right now. You can see right now, August 29th was our highest number at 279 deaths a week. I expect to see numbers similar to this over the next coming weeks. You can see it drop down significantly right now, but deaths take a long time to fill in. And so you really need to ignore these last 3 weeks. This one is, this is September 26th, the date of September 26th. There's barely any deaths that have been recorded since then. It takes about a month. So this is sort of the best number we have right now, September 5th at 270 deaths a week. And I expect the next several weeks as we continue forward through October will look very similar to this and the reason that is because the case numbers, and I know people say, they love to say case-demic, but we look at cases first because it helps us understand what's going on. And when we look at the case numbers by week,
as it slowly loads.
Yes. Let me put this back to a week. You can see that these numbers, they did drop down from August. And that August number that we saw the peak is a reflection of this August 15th case numbers because it takes about 21 days for a COVID-19 case to resolve itself. But you can see they're they've plateaued here. They went down for about 5 straight weeks, and then we're seeing an increase. And so there's a good chance this is September 26th, when it's fully filled in, will also be an increase or will be level with this. So we're looking at level deaths. And again, the hospitalization data also reflecting this. If we look at the hospitalization metrics for COVID-19 and we look at the inpatient numbers, you can see, again, a slow decline, but a very slow decline. It's gone from about 2,000 to 1,700. When you see these others, the decline was extremely quick. And this particular surge is behaving very differently from the last two surges. And we're seeing that in the ICU numbers as well. Most specifically, we're seeing it in the emergency room numbers. You can see emergency room visits for COVID-19 are still at peak levels for this surge. We're still seeing, they're still reporting every once in a while peak level emergency room visits here. So, again, indications not that things are rising, but that things are going to be plateaued for several weeks. which means the death numbers will continue to, stay essentially where they are right now, anywhere from 30 to 50 deaths a day.
Yeah, and that's why we could see
Sad, but
as
that's
we
what we're
were.
looking at.
Say that again, Garrett.
It's sad, but that's what we're going to be looking at, a range of about 30 to 50 a day for the foreseeable future, really.
Yeah, and it's not off from what we said when we looked at these projections a few months ago, that we were seeing that plateau and these same three numbers that we tracked: cases, then hospitalizations and deaths. And as we always talk about here, Garrett, the obviously the curves come in order. When there's a high case number curve, you and I can sit here and talk about this, but it really doesn't catch people's attention until some of these higher death numbers come out. And
Yes.
and sometimes then it's a little bit too late. If we hold on to this plateau, if we have these numbers high, that's the concern, that the hospitals won't have room for people who are sick with other things.
And the thing about the case numbers as well is anything that sort of is introduced, like for example, the booster vaccinations are being introduced right now. They're very low numbers here because only the immunocompromised are they're available only to them. But shortly, boosters will be available to like 65 plus in Arizona, and then things like
65 plus are ready right now.
Oh, are they already available? Okay.
Yes, 65 plus and immunocompromised. I've had family members who are 65 plus already going for their booster shot.
So
and
we do have numbers from Maricopa County. This is brand new.
The booster numbers are added on the chart already?
They are, yes.
Yeah.
So they said the reason that I thought that we only had immunocompromised is because the Maricopa County numbers specifically state that the third dose mRNA series says for immunocompromised. But this is what they have right now. They have about 57,222 doses right now that are in the system for the booster shot right now.
Yeah, and this can be found on Maricopa County's health department page.
Yes.
I just want to make sure.
It's amazing. I see people talking about adverse reaction numbers. Do you see this number right here? 4.4 million doses administered in Arizona. Like whatever the adverse reaction number, it will be nothing like even the infection fatality rate for COVID-19. So you have to put these things into perspective.
Most of our hospital systems,
massive number.
I know, Garrett. Most of our hospital systems here in Arizona, when we've checked in with them and asked how many people are in the ICU that have been vaccinated, it's like none.
Yeah, 4.4 million. I mean, if adverse reactions, they are not adverse reactions that are leading to hospitalizations. They're people that are staying home from work for a day because their system is getting, is ramping up for COVID-19. So you just got to put that into perspective. I know that there's anecdotal things all over social media and the news about things that happen with the vaccine, and there's probably some validity to some of them, and there's probably not validity to others. But again, we're talking about what is in reality a sample set of 4.4 million vaccine doses. No study out there anywhere that is looking at adverse reactions to vaccinations have anywhere near a 4.4 million person sample. So just understand that when you're talking about trying to sort of be contrarian on vaccination numbers.
Yeah, as Alex writes, people seek out only information that matches their worldview. We're finding that a lot, which has been one of the problems with social media. Alex, thank you for weighing in on this. Garrett, a few other numbers that we want to look at. I know we have a truncated amount of time with everybody here today. One of the things that they were talking about is making sure that our pregnant population is vaccinated as well. Just earlier this week, we have talked about this on the news, the CDC issuing this health advisory, and they're really urgently recommending pregnant women get the vaccine because of the numbers that we have seen and lives lost.
Yes, I've seen that as well. Let me see if I can pull that up on the CDC. I don't have it right now, but I can tell you from anecdotal evidence. My wife and I just had a baby only about 14 days ago. And
yes, congratulations, by the way. We haven't been live on here since that awesome event.
Thank you so much. And yes, as a family, my wife was one who had initially, was hesitant about getting the vaccine at the time. But she did get the vaccine and she had no adverse reactions to it. And that decision was made by her based on the CDC data and the sort of the recommendations that the FDA made over the month of August. And so that's just something to tell people about, what's happened with us. So
when having 3 kids myself, when you're pregnant, you barely have room as it is for your lungs. And I can't imagine having diminished capacity because of COVID and being pregnant, your body trying to grow another person. I know that it's a difficult and deeply personal decision, but with the CDC stressing this, and with the loss of these women in the last month who are pregnant, obviously of childbirthing age, so relatively young, and to lose them is heartbreaking. So that's why they want to continue to stress to get the
Yeah,
message
I mean,
out there.
let's face it.
I'm Tom Talbot, the chief.
Oops, sorry. It's an upper respiratory. Sorry about that. It's an
Yeah,
upper
that's okay.
respiratory illness, and I said when you're in late stage pregnancy, your lungs are compressed.
Yeah,
I mean,
yeah.
that makes you more at risk to be hospitalized. That's just
They're
the way it is.
also talking about Merck is asking for people to come forward if they'd like to participate in some of the trials to develop a pill. Some people are needle adverse. There's a small group who's saying, I would get the shot, but I'm just so afraid of needles that they can't necessarily overcome it. This would be just another option in the room to vaccinate. And what they're looking at right now is they're looking for volunteers to do this. It would be a couple of pills twice a day, and it would just be another option. And they're seeing if it would work to being able to vaccinate, and just having another tool in the toolkit. Another thing they were looking at is a small patch with microneedles that people would be able to put on to give a dose of the vaccine to themselves. It would help in rural areas or places that they have a little more trouble getting the vaccine. By now, pretty much we found ways to get the vaccine everywhere. But if there were other countries or places that didn't have easy of access, that this would be just another option to help vaccinate the world at this point. And so it's really hopeful to see some of these other things take shape out there. Garrett, what are some of the other things you're going to be watching in the next couple of weeks? We're not going to be here with you next week because it is fall break. We're going to be enjoying time with our family. We want to make sure all of you have the tools to find the information that you want throughout this. AZDHS is always a good site that we always recommend to all of you to find the very latest data. But Garrett, what do you recommend, and what are you going to be watching? We're really trying to see if this plateau is going to hold or drop off.
Yeah, that's really what it comes down to is really watching what's going to happen with the COVID-19 cases. Now, obviously, we're looking at fall break. People are going to be going on vacation, which interesting will likely not really impact the numbers because people are not going to be gathering in large family groups. They're going to be going off on vacation and doing things. So we may not be seeing a case increase just because of fall break. But we do have to look at those case numbers to see where things are going, because really that tells us the best indicator of where things are going to go from here as far as what these death numbers will look like, these hospitalizations numbers. So far, everything is held the same thing over the course of this entire pandemic, where cases lead to hospitalizations, lead to ICUs, and then lead to deaths, unfortunately. But that's sort of the line, and that line has sort of followed this entire time. So depending on what happens with this case plateau, if the case plateau continues to deflate, which is what it's doing right now, and that continues, then, we should also see lower numbers of hospitalizations and possibly lower numbers of deaths in the next 3 to 4 weeks. Again, not knowing what happens in the winter, because when the winter starts to happen,
the flu season specifically,
the expectation is that there will be a surge. The expectation is it's not going to be as heavy as the winter surge we had in 2020, but that there is going to be a surge, and that will infect the death numbers. Hopefully, nowhere near at what they were, and it should not be anywhere near what it was in 2020, simply because of the vaccination rates of the 65 plus community.
Yeah, and I know when we're looking at these 20,000 cases, I just want to pause as we close here for a moment and not only remember the families who have lost someone, who have a gaping hole with these 20,000 lives lost, but Garrett, also the nurses and the doctors. Most of these people died in a hospital. Obviously some could die at home, but of 20,000 COVID patients, a large majority of them dying in a hospital. That means there was someone there 24 hours a day to give care to them. There was someone to hold up the iPad to let their friends and family say goodbye. And the trauma of just listening to that, to listen to a family member say goodbye to their loved one, the trauma of trying to take care of a person and nurse them back to health only to lose them. We just want to recognize all that our nurses and doctors have done for all of these people in these families throughout this pandemic. We're going to wrap it there. Sorry we didn't have as much time for you today. I want to let you know where you can find all of our very latest reporting on coronavirus. You can find it on abc15.com/coronavirus. I want to remind you that we have newscasts coming up today at 4, 5, 6, 9 over on CW61, and also 10 p.m. Garrett and I don't know, are you going to be on Twitter at all during your time off, or are you going to try to
probably.
So you can find Garrett periodically. We'll give him a little rest in there at Garrett_Archer. His updates right there on Twitter. You can find me on Twitter at Katie Rammel. I know many of you are watching us live here right now on Facebook. You can find me on facebook.com/news from Katie. And let me think, what else am I missing here? Schools. If you need more schools information, you can find that also on abc15.com/schools. So in the meantime, be safe out there. We'll have more for you right back here in 2 weeks.